Matthieu de Klerk, in these unprecedented, uncertain, abundance of caution, COVID times.
Times of caution.
Times of caution.
Abundance of caution.
As we said before, I hate all of those words now because I'm hearing them too much. We are doing our Hippo Education and EP Monthly April 2020 discussion.
April 2020.
And you have pointed me to the Tackling Coronavirus 101 with William Sullivan, DO and JD, which means he will first he will treat you and then he will sue you on your way out because you were mean to him. So don't screw with that guy.
That's right.
But
Right.
what does this
I never
one say?
messed
We've been doing
around
a
with
lot
him.
of
And I
COVID
always
stuff.
really wrote, but he did
Lots
a
of
good job.
COVIDs.
I mean, look, all this information is changing constantly. There were a couple good things here. Some of them just good reiteration for the public. Don't go to the emergency department to get tested because we aren't going to have the test. We won't do the test. And if you didn't have coronavirus, now you do because you went to the ED.
Or you gave it to me.
So go there if you're sick for sure. Please, by all means, that's why we're there. Self-quarantine is a 7-day thing, not 14. That's half of what previous. And I think we're going to kind of see that number change as people are like, oh, you got to go back to work. And then 3 days after resolution of symptoms. So those are good information for us healthcare workers. Like when can we go back to work if we're sick? And then the last one, really, we're going to be seeing a lot of patients with coronavirus. We cannot have follow-up for all of them because, well, primary care is pretty much shut down. But just replace it with good return precautions. Yeah. You get worse, short of breath, come back, because that's really the pitfall there, right? They come in early, and it's that 2-week mark when it catches up to their lungs. So good return precautions and reassurance.
There's a lot of sort of good common sense coming out of this thing. Also, a lot of telemedicine stuff that's coming out of this thing, which we can talk about. But
we have an article on that, so hold it.
I'll hold all that for you. We've done a lot of COVID stuff at Hippo. You've done a lot of COVID stuff at Hippo, including your PPE talk, which had a jillion
donning and doffing.
Yeah, donning and doffing. And then we had to cancel Essentials, which is the first time that's happened in a decade and a half. And
in the history of Essentials.
In the history of Essentials, yeah, first time. We'll make it up to you. But unprecedented, Matthieu de Klerk. It's a good thing your name is so hard to spell, or I would probably tweet about you more.
All right. Hit the flusher.
See you later.